Hello and welcome to the Daily Aus. I'm Emma.
I'm Sam.
At least 200 psychiatrists have resigned from New South Wales public hospitals after a mass departure of psychiatrists from the sector last year. It comes amid an ongoing dispute with the state government as psychiatrists call for better pay and better working conditions. After this latest round of resignations, there are fears the sector could be reduced by 2/3 before the end of the month. GPs are warning it could trigger a mental health crisis on their end. So what's going on?
Well, Emma, today we'll talk you through this ongoing dispute and unpack the stalled negotiations between the New South Wales Government and the Doctors' Union. But first, I think a lot of people can get mixed up between psychiatrists and psychologists. Give us a quick recap on the difference between the two and who we're actually talking about today.
Yep, so psychiatrists, that's who we're talking about today, are medical doctors, and they specialise in the diagnosis and the treatment of mental health conditions. The biggest thing that separates them from psychologists, you could argue, is that psychiatrists can prescribe medications. So they're doctors, they prescribe meds. Psychologists are the people that we might go and see to do therapy.
Yep.
We might not get a prescription for medication from them. So that's the important distinction. Another important distinction today, before we get really stuck in, is that we're talking today about psychiatrists who work in the public health sector. So we're not talking about psychiatrists in private practice. We're talking about the ones that might work in hospitals, other state-run mental health services. So that's the kind of disclaimer ahead of today's chat.
So they, on their pay statements at the end of the month, would have the New South Wales Government as their employer.
Exactly.
Okay, so there's been a mass resignation of psychiatrists who work in this public health space. Where have these walkouts come from?
Essentially, it all boils down to a dispute over pay and over working conditions. So psychiatrists in this instance are workers represented by a union, the Australian Salaried Medical Officers Federation of New South Wales, but thankfully for us, they're also called the Doctors' Union. So I'll be calling them the Doctors' Union throughout the episode.
I prefer ASMOF.
Now, ASMOF New South Wales, or the Doctors' Union, have been advocating for reform for several months to improve what they say is a dangerously understaffed sector. Now, before these fresh resignations, about 1/3 of psychiatry positions in public health were vacant in New South Wales. The union says this presents a risk to patient welfare, so there's an impact on the type of care that patients are able to receive, but that also there is a staff shortage placing enormous pressure on the existing workforce. So the psychiatrists left behind are kind of suffering under all of that pressure.
And I know that today's discussion is about the New South Wales division of this union, the psychiatrists in the state. Does it represent a national trend? Is this happening all over the country?
Yeah, I mean, we know, especially on the other side of COVID, that health providers and hospitals right across the country have been struggling. There's resourcing and staffing issues all around the country in various sectors. But there's an interesting separation here, which is about a pay disparity when it comes to New South Wales health specialists. And this has really formed the basis of these negotiations. The Doctors' Union released a report last year that found a 30% pay gap between what New South Wales public health psychiatrists earn and what their counterparts interstate are earning. So that's really the gap that the Doctors' Union has formed the basis for its negotiations, what it's demanding, and that pay gap is kind of really driving those staff shortages currently seen in New South Wales. As the union said, why would a psychiatrist want to work for New South Wales Health when they could make 30% more or be 30% better off working somewhere else?
Okay, so let's take stock of all of this. We've got a workforce of psychiatrists in New South Wales who are, according to them, not only paid less, but also are overworked, which they say presents dangers to patients and also to the psychiatrists themselves. That's the position they took into the negotiations with the state government. What are the specifics of those negotiations? Like, what are both parties trying to reach here to make the conditions better? Is it just pay?
So, as it so often is in these cases, it's a lot more complicated than just pay. Negotiations began back in September, and I think it's probably fair, both sides would probably agree that very little progress has been made so far. The Doctors' Union is seeking a 25% pay increase for psychiatrists and, as we mentioned, improved conditions to address these concerns in the mental health system. So that includes things like improved rostering systems and job security, better workplace safety, safer working hours, and access to certain entitlements like parental leave. The New South Wales Government, in reply, has proposed a 10.5% pay increase over 3 years.
So we've got almost a 15% gap between the positions of the two parties around the negotiating table.
Yeah.
I'm assuming that offer was rejected. So what's happened since September?
Hi, I'm Zara. I'm the co-founder of the Daily Aus, and we started this company because we think news can be done differently. If you agree, you can hit subscribe. It's the best way to help us grow. Now, back to the video.
Yeah, so the union, as you rightly guessed, rejected that offer immediately in September, and it's claimed since then that the government has refused to budge on these negotiations. So since then, half of New South Wales public psychiatry workforce has submitted their resignations. We had a tranche of resignations in November, around 140 people. That number has now increased to 200 resignations. And the union has reiterated this idea that the doctors really don't want to quit. It's not that they want to walk away from the sector or their jobs in public health. It's more about being overworked, overwhelmed, and the union says these workers are completely demoralised from working in a broken system, and basically they've been left with no other option.
And give me a sense of 200 psychiatrists resigning. What does that mean in the broader picture of the New South Wales health system in psychiatry?
Yes, so in total, there are about 295 psychiatrists working for New South Wales Health. So we're talking about more than 2/3.
That's a serious chunk of the workforce.
A massive chunk. And the resignations are expected to take effect from the 20th of January. So
gosh, that's
next
a big
week.
Day, isn't it? That's also the inauguration of Donald Trump in the US.
Yeah, a bit
lot
happening. The TikTok ban,
Yeah,
a little
wow.
bit on. What that could mean is that we see those psychiatrists moving into private practice, but it does leave that gap for urgent psychiatry care. The Royal Australian and New Zealand College of Psychiatrists is the peak national body for the sector, and it's been pretty vocal about wanting to reach a resolution before that 20th of January deadline to avoid these gaps. It says that previous staffing gaps have created a crisis for the psychiatry workforce in New South Wales, and it's warned the mass resignations would significantly impact some of the most vulnerable people in our community.
Sure.
Which is important to remember when you think about who is accessing urgent psychiatry care. RANZCP released a statement saying disruption to care for those vulnerable people will have wide-ranging impacts. And separately, there's this interesting conversation going on with the general practice industry. The peak body for GPs has warned that failure to reach an agreement could impact GPs who are already managing high demand for mental health consults.
Sure, well, they'll have to kind of fill a vacuum almost, because the number of people who would presumably need psychiatry services would not magically decrease by 60%. So that's going to need to be serviced by somebody else.
Exactly. And there's a whole other separate issue of what psychiatrists can prescribe for treatments versus what GPs can prescribe. If you're familiar with ADHD medication, you can't just walk into a GP if you have an ADHD diagnosis and get that medication straight away.
I want to understand the response from both New South Wales Health and the New South Wales Government. They're different bodies. The negotiations are happening with the government, but New South Wales Health as the employer is obviously going to feel the impact of this as well. How are they planning to address this sudden shortfall in psychiatrists?
Yeah, so the Department of Health has issued an update in anticipation of these disruptions to its public mental health services. It said it's working on plans to manage the impact of this proposed mass resignation of around 200 psychiatrists. The specific details of what those plans look like are yet to be seen. But it did warn that there could be extensive disruption to services and the broader public health system from the 20th of January. So not a lot of detail, but essentially the Department of Health conceding that this could be significant for a lot of people.
And so then the New South Wales Government, as the opposing side in these negotiations, they must have their own position on why they're not coming to the table. Explain to me why there hasn't been a resolution from their perspective.
Yeah. More broadly, the New South Wales Government has been locked in a range of bargaining agreement renegotiations with health employees. One of the more high-profile breakdowns in negotiations people might remember is the nurses and midwife negotiations
Yeah.
that led to mass strikes last year, delays in elective surgeries. In between all of that, of course, we have this going on with the psychiatrists. The state's health minister, Ryan Park, has basically said that their requests are impractical. The pay increase request specifically is not feasible. He said that the government doesn't want to see these resignations take place, that psychiatrists are valued, that the government values the work they do, but that they're not in a position to offer wage increases akin to around about $90,000. And we've also heard from the New South Wales Liberal opposition. It's accused the Minns government of abandoning the state's most vulnerable, and it said that the psychiatrist shortage is going to leave people without the care they urgently require. Shadow Health Minister Kelly Sloan said Labor must address the issue as a matter of urgency for psychiatrists, patients, and the broader community, who she said are all at risk if a solution is not brokered.
And I think it's an important piece of context here to remind everybody that historically, this is not unusual, no matter what the sector is. I mean, we've seen it with train drivers, for example, in recent months. There normally is some sort of resolution reached between the warring parties, often, 5 minutes to midnight on the last day of the negotiations.
It's all about compromise.
And there is still a little bit of time before that 20th of January deadline. But I really appreciate you talking us through the context behind this so that when we hear about whether those negotiations reach a tipping point and, in fact, a resolution, hopefully, that we understand a bit about where that's come from.
Thanks so much for having me, Sam.
And thank you for joining us on the Daily Aus today. If you enjoyed this episode, it would mean a lot to us if you shared it with a friend. It really helps us grow. Perhaps somebody who is a listener of other podcasts and they're ready for a news one, sending it to them would make our day. We'll be back again in the afternoon with your headlines. Until then, have a great day.